안녕하세요. 매일매일 운동하기를 실천하고 있는 동탄 왕코입니다. 토요일 아침이에요. 오늘부터 오후 출근입니다. 어제 야간 퇴근하고 조금 자고 12시에 일어났어요. 근데 그러고 나서 한 번도 안 잤거든요. 제가 낮잠도 안 자고 새벽 1시까지. 와, 근데 새벽 4시에 일어나져가지고 죽을 것 같아요, 지금. 지금 오전 10시에 넘었는데 11시 다 돼가는데 피곤합니다. 원래 야간 끝나고 나면은 이틀을 쉬어요, 제가. 하루 쉬는 애들도 있긴 한데. 근데 요번에는 이제 근무가 약간 좀 꼬여가지고 하루 쉬고 오늘 하루 출근하고 내일 하루 쉬는데, 오늘 아마 회사에서 죽을 것 같은데. 아주 큰일입니다. 일단 오늘 날씨 흐리네요. 구름이 가득 찼습니다. 어제 날씨 진짜 좋았는데 푸른 하늘 볼 수 있어서 되게 좋았는데 오늘은 진짜 딱 겨울 날씨입니다. 운동을 하겠습니다. 어제 여러분도 안 믿으시겠지만 어제 운동 진짜 많이 했어요. 하루 종일 운동만 했습니다. 못 믿으시겠지만 너무 졸리는데 너무 멍하다. 우선 스트레칭 위주로 하고요. 스트레칭하고 씻고 출근 준비를 하도록 하겠습니다. 여기 운동할 때 CNN이죠, CNN.
Day out in their day-to-day lives and they're talking about it among their friends. So it's hard to kind of counter that message from a 10,000-foot perspective with Ronna McDaniel telling people to go ahead and vote when they're not listening to the Ronna McDaniels of the world. So this is a profound problem for Republicans because I think their disinformation could be coming back on them, and we've already seen that like in 2018 when President Trump is not on the ballot, it is a little bit harder for those types of voters who kind of help him along to come out again for Republicans down ballot.
Paul, how concerned are Georgia Democrats about their voters getting a little complacent?
Very. Well, they're not complacent. It's just very hard. I've been through a lot of races in Georgia, as you know. I used to work there, and the Democrats usually have the harder time in a runoff motivating their base. A runoff is about motivating your base and unifying your party. Mr. Trump motivates his base, but he does not unify his party. Democrats usually have a hard time moving two key groups: young people and African Americans. And guess what? The two candidates are John Ossoff, who's like 9, and Reverend Raphael Warnock, the pastor of Ebenezer Baptist Church, the most storied church in America. So I actually think that's pretty hopeful for the Democrats. But again, I don't think the Democrats should fall into this trap about talking about Trump and his feud with Brian Kemp. They need to talk about people's lives. And I do think Ossoff and Reverend Warnock are doing that.
Yeah, I'm going to leave it there. Paul Pagala, Scott Jennings, Happy Phillip, thank you so much. Appreciate it. A COVID vaccine could be available to 20 million Americans by the end of this month. Dr. Sanjay Gupta and I are going to discuss that and more. Dr. Fauci, that's in our next hour, starting about 10 minutes from now in our CNN Global Town Hall. The vaccine will be obviously a relief for many, but not everyone is rushing or lining up to try to get a shot. A lot of concerns, especially in one of the states being hit hardest by the virus and within communities hit hardest. We'll take a look at what's fueling those concerns.
All out, driven with determination, endless dedication.
진짜 폼롤러가 짱입니다, 여러분. 집에 무조건 하나씩 있어야 돼요.
Breaking all limits, giving up.
그냥 들어 눕기만 하면 스트레칭이 되기 때문에.
For your health matters most, so we'll never stop advancing ourselves to be ready for anything. BDMS, your trusted healthcare network.
我们的这些孩子们，他们现在所更需要的是听到世界的声音，并且能将自己的声音传递到世界的每一个角落。
这个电脑教室它最大的一个意义就是让孩子们尽快的跟这个外面的世界去接轨，然后也给他提供更多的这种学习的资源。 创造一个更好的现在和未来。我们之后能够跟星展一起，给更多的孩子们送去一个平等的享受优质教育这样一个机会。
These are the portraits of purpose we're enabling at DBS Bank.
We try to be global and we try to be smart. But I want to hear our authentic voices of people who are passionate, who are intelligent, and that's the consistency that we try to get at.
Fareed Zakaria GPS, Sunday on CNN. All new African Voices Changemakers. Create opportunities. Impact communities. Transform lives. Photojournalists capture the authenticity of their communities.
Kibera Stories is a long-term photo project with an aim of raising awareness about the daily lives of people living in Kibera.
African Voices Changemakers, only on CNN.
This is the 100 Club, our look at companies that are 100 years old or older. Dannon yogurts are known the world over. The business was fermented in the Spanish city of Barcelona, where Dr. Isaac Carasso began producing yogurt to help combat indigestion among children. In 2017, the company launched a new slogan, One Planet, One Health, and has now committed to making all of its packaging reusable, recyclable, and compostable by 2025. To mark its centenary, Dannon has allowed access to almost 2,000 of its yogurt strains to help scientific research into food and health benefits.
I guess the essence of the story of Danone is entrepreneurship for health.
This is CNN. More people get their news from CNN than any other news source.
The COVID vaccines certainly can't come soon enough, but they are coming. And there's a hurdle of convincing Americans that they will be safe to take. Many are expressing hesitancy, particularly in some Black and Latino communities. Our national correspondent Jason Carroll spoke to residents of one of the hardest hit towns in Alabama on what is fueling that distrust.
Hobson City, Alabama. The term city used loosely, it's really a small town. Population about 800.
We are a small community, small enough to know everybody and everybody's cat.
Hobson City's mayor says small enough to know that when it comes to trusting in a COVID-19 vaccine, many people here feel the way she does.
I'm reluctant to take the vaccine.
Wait, you yourself are reluctant to take it?
I am reluctant.
Most of those who live in Hobson City are African American. Distrust of the medical community runs deep. The town, located about 100 miles from Tuskegee, Alabama, home to one of the darkest chapters in American medical history. In the 1930s, government doctors conducted experiments on black men, leaving them untreated for syphilis until the 1970s, so doctors could monitor how it affected them. Alabama is taking a beating from the coronavirus, the state's 14-day positivity rate at just over 29%. In Calhoun County, where Hobson City sits, the rate is 37%. Still, older residents such as Joe Cunningham have such little faith in doctors, he was reluctant to go in for a COVID-19 test, and any discussion about a vaccine is off the table.
I was afraid to take the test.
Why not, Mr. Cunningham?
I don't know. I just don't understand it. I'd like to know where it's coming from.
I'm gonna have to convince my father because he don't know what this vaccine is about. As black people, that's all we know is to trust the Lord and trust God. We have to convince our family that this is the right thing to do because this will help slow it down and help us to survive.
Distress in communities of color is not just a small town problem, it's nationwide. A study conducted in September exploring the issue in Black and Latino communities found just 14% of Black people and only 34% of Latinos trust a vaccine will be safe.
It's like it's almost to me like a fear. Like I have a phobia of needles. I'm almost at that point where I have a phobia of doctors.
Carmen Bailey was diagnosed with COVID-19 in April. Bailey says she avoided medical help because she feels she has been poorly treated by doctors in the past. Now the grandmother of 3 suffers from adverse effects with her heart, lungs, and kidneys.
Sometimes I can barely walk, and I'm tired of hurting. I don't know what to do.
What she will not do is take a vaccine.
We don't know any kind of side effects from them. So I just really feel like at this point where it's people that's going to take that vaccine as guinea pigs.
You really think they're guinea pigs?
I do. I just feel like we don't know enough.
Dr. Margaret Larkins Pettigrew and her husband, Chenis Pettigrew Jr., know the health community has a number of hurdles to overcome to reach communities of color.
When you talk about trust, you're looking at that tug of war. So, do I trust the science because they're telling me this is what's going to help me, but I have a lived experience that says that this may not be so because I have been deprived of other things.
The Pettigrews come from a place of experience professionally and personally. Both lived and worked in Tuskegee for a time. Both are participating in a COVID-19 vaccine trial currently underway. And the couple is advocating for trust in the science behind a vaccine.
We thought that it was important to make this contribution and to represent the community that we're part of in a way that says you can do this and you can take this vaccine.
Was there any hesitation at all?
I had no hesitation. I see what happens when people of color are not included in studies. And that is the downside of things.
Back in Hobson City, Mayor McCrory says she has had a change of heart, but it had little to do with science.
I sat across from a young man who came in to purchase a grave for his 59-year-old wife who died of COVID-19 last Wednesday. And if anything makes me change my mind, that changed my mind. His wife's grave will be right over there in our cemetery. 59 years old.
He changed your mind?
He changed my mind.
Jason Carroll, CNN, Hobson City, Alabama.
A lot of distrust. A lot more to come on the vaccine front. Our coronavirus town hall, the vaccines on the other side of the break. An entire hour of your questions with Dr. Anthony Fauci here to help answer, along with Dr. Sanjay Gupta, who I'll be co-hosting with.
My name is Emmanuel Ahimieho. I'm the project manager of Bandana Kaba Road. We don't need to import anything that we need on the road. They are all locally available materials. So people from the community, they end up becoming suppliers. I think it has brought life back to the communities. And to be able to lead those people to achieve something worthwhile, something that is of value, I feel extremely proud.
The race ends here. The TV World Tour Championship. And need to be like all the states.
It's a fantastic week. Mentally, really tough golf course.
Special scenes out there today.
He's up there, and he's got the jackpot.
Hey, I'm Anderson Cooper. I'm excited to let you know that my digital show Full Circle is back. You can watch every Monday, Tuesday, and Friday, 6 p.m. live, Eastern Time, or anytime on demand. And to make sure you never miss a show, you can get alerts on every episode via the CNN app. I'll see you then.
I'm Jim Bitterman in Paris, and this is CNN.
Coronavirus. To get daily news updates in your inbox, sign up for the CNN newsletter. Coronavirus. Fact versus fiction.
Anderson Cooper.
And I'm Dr. Sanjay Gupta. This is our 23rd CNN Global Town Hall on the coronavirus. Only this time, the title is a hopeful one, the vaccines. As always, we're being seen around the world on CNN International and streamed on CNN.com.
As we come to you tonight, 2 vaccines right now, one from Pfizer, the other from Moderna, appear to be on the cusp of FDA approval, which of course is only the beginning. It's going to take a massive effort to produce and distribute, store and deliver doses to people. Yet according to President Biden today, he is not
20만
satisfied
명?
with what he's
2억
seen.
명? 20 million.
There is no detailed plan that we've seen anyway as to how you get the vaccine out of a container into an injection syringe into somebody's arm. And it's going to be very difficult for that to be done in this very expensive proposition. There's a lot more that has to be done.
Well, just ahead tonight, we'll ask the nation's preeminent infectious disease expert, Dr. Anthony Fauci, about that. He's been tapped, as you know, to serve as a chief medical advisor in the Biden administration.
And we're also going to ask Dr. Fauci about the National Vaccine Advisory Committee's decision today to not recommend an emergency use authorization for a COVID-19 vaccine in children. And in addition, your many questions for Dr. Fauci. Please tweet them to us with the hashtag CNN Town Hall. You can leave a comment on the CNN Facebook page as well.
And a lot of you have sent them in video form, which we appreciate. You can see some of them up on the screen, and we'll get to as many of those as we can tonight as well. We'll be joined by a couple who took part in vaccine testing who'll tell us about their experiences and the side effects one of them felt. In addition, we'll talk about the months ahead and how rough they're going to be, vaccines or no vaccines. Today, so far, we're the 3rd worst day ever for new cases, nearly 204,000 new infections, and still climbing. The University of Washington Health Metrics team is now projecting more than 250,000 more lives lost between now and April. So there's a lot to get to tonight. First, Sanjay, this is the point in each of our town halls. We get a checkup from you on where you think things stand. How do you see things right now?
Well, you know, Anderson, since this pandemic began, I've thought a lot about this country as if it were my own patient. You know, I saw COVID-19 sort of start as this localized disease in just a few places around the country. But the country, the patient, ignored some basic treatment advice that could have been very effective, and as a result, the disease spread. And now that localized spread has spread throughout the entire body, this country, leaving no state really untouched, and the patient is more vulnerable than ever, and yet still in some ways unwilling to undergo the necessary treatment. So as you talk about, Anderson, there's the hope of a vaccine on the horizon. But I can tell you as a doctor, the medical community doesn't have the luxury of waiting. They are tired and they are overworked and they are stressed, and the patient, the country, needs help right now. The thing is that the treatment plan is not complicated. Masks, they're almost surgical in how quickly they can make a difference. The virus simply won't have anywhere to go. If people are masked up, the more people wear them, the more lives can be saved. It's pretty simple. We also know that 80% of the infections in this country are occurring in just a few locations. So we have to be particularly aggressive there. Not shutting down, just reducing maximum capacity in places like restaurants and gyms and bars. Those treatments alone could make a huge difference. You add in more testing, you add in contact tracing, and we could be on our way to good health even before a vaccine arrives. But the question has been, will my patient, this country, listen this time around? As you know, Anderson, more than half Americans now say they know someone personally who's been hospitalized or died of this disease. And just this week, more people died of COVID than died of heart disease in an average week. Heart disease, which is the leading cause of death in our country. So we got a big problem, to your question, Anderson, but also a prescription to help.
Yeah, when it comes to vaccine distribution, the devil is certainly in the details.
And to get a glimpse of that, to get one of the more complicated parts of the chain, CNN aviation correspondent Pete Montine is at the airport for us.
So Pete, what kind of preparations
this is American Airlines
are you seeing?
Sorry, I didn't mean to jump the gun there, Anderson. Yeah, this is American Airlines cargo cold storage facility here in Philadelphia.
저게 백신인가 봐. 미국에 도착했나 봐.
Essentially one big refrigerator here,
필라델피아.
25,000 square feet. You can see the cold air blowing in from the fans over there. It's about 40 degrees inside.
지금 막 질문이 엄청 올라오는데
will help preserve
부작용,
specialized
사이드 이펙트에 대한
containers for the
내용이랑
vaccine that need to be
그다음에
super
how
cold.
long,
The Moderna vaccine, -4 degrees
이펙트
Fahrenheit.
얼마나
The
효과가
Pfizer
있냐,
vaccine,
얼마나 오래,
100 degrees Fahrenheit.
뭐
They would
6개월마다 한
send
번씩 맞아야 될
themselves
수도
in a
있는
place
거고,
like this,
1년에 한 번씩 맞아야 될 수도 있는 거고, 한 번 맞으면 끝일
just a
수도
pit
있는
stop,
거고.
airlines say,
아직
albeit a
아무것도
very
모르죠.
critical one on the road for getting the vaccine administered to you.
그리고 과연
Airlines
전
say
세계
they
사람들이
will
이걸 다 맞을 수 있냐 이거죠,
to
백신을.
have the vaccine
아프리카,
in their
아니면
possession.
동남아나 다른
It's interesting, Pete. I've heard
가난한
American Airlines
나라들.
also doing these test flights to make sure they're
진짜
ready.
괜히
Medical
우리
supplies
세대가
go,
마지막
we're playing
세계
all the
여행
time.
마지막
Is
자유여행
there
세대라는
something
게
special
괜히
about
나온
these
말이
test
아닙니다.
flights? Well, I just want to show you one more way that airlines are keeping the vaccine cold while it's in transit, Sanjay. Out here on the floor is a specialized refrigerated battery-powered shipping container. You can set the temperature on this. I'm just going to punch the screen here. 32 degrees Fahrenheit. Alarms go off in this if the temperature is off by even a quarter of a degree. Airlines say they already have the infrastructure in place for a mission of a lifetime. American Airlines says it has a plan in place that once the vaccine is FDA approved, it can begin shipping it within 24 hours.
Pete Martin, appreciate it. Thanks. Joining us now, Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases. He's also soon to be Chief Medical Advisor in the incoming Biden administration. He's, of course, still a member of the White House Coronavirus Task Force. He was last in our CNN Global Town Hall back in July. Needless to say, we were very happy to have him join us tonight. So, Dr. Fauci, you just saw a reporter going through some of the distribution logistics at the airports. President Biden is saying, quote, there is no detailed plan from the Trump administration about distributing a vaccine. Have you seen a plan? What's going on?
Well, there clearly is an organized approach that's right from the military component of Operation Warp Speed, General Gus Perna, who's responsible for the actual transport. The planes, the trucks, the trains that take the material, in this case, the candidate vaccines, from the storehouses, the warehouses where they are, after they've been filled and finished, to the local places of distribution, namely the state and the city local areas.
이거 좀
Once it
운동
gets
끝나고
there,
출근하기 전에
it
한번
is
좀
up
검색을 좀
to
해봐야겠네.
the state and local authorities in their individual way to make the decisions about the distribution as well as the logistics of it. So it really is going to be at the level of the state. So I think that's what is meant by not having a broader global in the sense of the whole country plan, but the individual states and localities will make their decisions and to give it the distribution the way they normally would distribute something like influenza vaccine. So that's really the way it's going to be, very much locally mandated for the actual distribution from the bottom into the arm of a person, as opposed to transportation to the particular site.
얼마나 있죠?
Dr. Fauci, good to see you. Thanks for joining
23분.
us. I wonder if you could give us a picture of what it's going to look like. I mean, where will most of the vaccines actually be administered, do you think? Through doctors' offices, hospitals, CVS and Walgreens type locations?
Yeah, Sanjay, it's going to be all of the above. So it's going to be CVS, Walgreens, doctors' offices, clinics, and hospitals. I know that because they're already been shipped, ready for distribution. And, like you would do, Sanjay, I've made a couple of calls around right here where I live in Washington, and already we know there are some hospitals, some clinics that already have material that has been shipped to them. So the answer to your question, Sanjay, I think is going to be all of the above.
So when you said hospitals, some hospitals already have it, that means, I mean, when do they get the go-ahead to start, inoculating people?
Yeah, as soon as the EUA is officially administered
Emergency use
by the FDA,
authorization.
right, the emergency use authorization, essentially immediately after that, it likely will be a day or at the most a couple of days. But it is essentially right from the time that you get the official authorization by the emergency use authorization, what we refer to as an EUA.
You recently apologized for criticism of the UK's speedy authorization of the Pfizer vaccine. Can you just talk about your initial concerns about that and the speed at which this is happening?
Well, you know, we here in the United States, the Food and Drug Administration, no doubt, really is the gold standard of really careful scrutiny of all of the data, all the minutia of the data of the clinical trials. That's just the way our FDA works. Some may say it's a bit too careful, a bit too slow, but it really isn't. It really makes very much the front burner safety and absolute certainty of efficacy. Other regulatory agencies in Europe and the UK may do it a little bit differently. You know, not necessarily
놀아도 돼,
worse,
놀아
but
되는데
just a little bit differently. We do it in a way
노는 것도
that may seem to be
한두 번 놀면
very
되잖아요.
careful
남는
and
시간
very, very
엄청 많단 말이에요.
slow, but it really
공부하세요.
isn't. The career
운동을 하든
scientists
공부를
at the
하든
FDA, they know what they're
뭔가
doing.
나한테
They do this for a
맞는
living. They do it all the
그런
time.
일을
They're doing it as quickly as they
뭔가를
possibly
계속
can.
해야 됩니다.
But for sure, it's going to be done very carefully
나중에
and with a great deal of scrutiny for the data.
30대가 되었을 때
Last hour, Jason
40대가
Carroll had this
되었을
great
때
piece about vaccine hesitancy, a topic you know well, particularly among
정말
Black
후회하게
and
될
brown
겁니다.
communities. You know that these communities have been disproportionately hit by this virus, and they have higher rates of vaccine hesitancy as well. This seems like a major issue to address. I'm just wondering, as you're going to be part of the Biden team now, what tangible steps will you take to sort of build that trust?
팔굽혀펴기
Yeah,
마지막으로
well, we
20개만
will be
하고
taking steps,
끝내겠습니다.
Sanjay, and we are currently taking those steps, and that is by really rather, I would say, active community outreach, which we've already done. We do it by PSAs. We do it by engaging through our community groups that are associated with our clinical trial apparatus. And we do it by engaging leaders in the community. There already is a plan to get people who are respected by the community, athletes, faith-based organizations, personalities, celebrities, to go out there and get people to be vaccinated. You know, it would be a terrible shame if we have the African American and Latinx community, who, you're absolutely correct, are disproportionately suffering more from this outbreak if they did not take a vaccine, which we know to be extraordinarily efficacious in preventing clinical COVID-19 disease.